The patent-pending Odulair Ebola Isolation Unit exceeds the CDC guidelines for treating an Ebola patient in a US hospital by providing multiple layers of patient isolation and a protective environment for your medical staff. Clinical teams treating Ebola patients in West Africa and the US have reviewed and vetted the design for effectiveness and efficiency. The 40 by 40 foot module is a complete facility with all ancillary areas necessary for 2 patient isolation rooms, and multiple modules can be combined to create a larger Ebola isolation hospital. Patients enter into the isolation room directly from the outdoors, keeping the medical staff protective environment pristine and free of accidental patient contamination. The expansive interior windows provide a continuous direct view between medical staff and patient, making each feel more secure in this unique isolation unit. Patients also have the option of entering into their isolation room through their private ADA-compliant handicapped accessible bathroom. All isolation measures necessary for Ebola patients, including bodily fluids, skin, and multiple layers of airborne infection isolation, are optimized, and yet the patient room feels open, inviting, and safe with a multitude of windows in all directions. Upon arrival, the medical staff enters the Odulair Ebola Isolation Unit through their own main entry directly into the positive pressure medical staff protective environment. The team has both direct and closed-circuit TV visualization of their patient at all times, as well as two-way voice communication via an intercom. Entering into the patient's isolation room, the staff first checks the hot zone room pressure monitor, then traverses through the dressing room to change into their disposable scrub suit. They then proceed into the PPE donning room with the buddy to ensure proper PPE coverage of all body parts. One staff member may elect to view the patient procedure from this vantage point, providing an extra set of eyes for their colleague in the patient isolation room with whom they can communicate through the intercom system. The same capability is available from the combination anteroom and decontamination room. The pressure-monitored patient isolation room exceeds all US building code requirements for an airborne infection isolation room. Patient-specific supplies can be stored on rolling tables to avoid the medical staff bending over, increasing the risk of accidental contamination. Human waste from the bathroom can be sterilized in an optional autoclave. The same autoclave can sterilize red-bagged biohazard waste, which is temporarily stored in a barrel in the patient's room. Expect an average of 7 or more barrels of waste per day per patient. When full, the barrel can be rolled on its specialized cart through the decon room and into the waste holding room. Later, the barrels will be removed via the exit doors to be deposited into the pass-through autoclave for safe disposal of the sterile remains into the sewer system. The Odulair Isolation Unit also incorporates the latest technological advances such as the InTouch Health RP-Vita, the world's only Class II robo-medical device enabling high-acuity telemedicine care delivery and remote presence consultations. We utilize the RP-Vita robot as a visual spotter to help prevent accidental staff contamination. The RP-Vita is an autonomous robot that can significantly decrease the number of interactions required of healthcare workers in the contaminated hot zone by providing automated delivery services for medications, oral rehydration fluids, food, and other supplies. Each of these advances furthers the Odulair mission of actively protecting healthcare workers from known and suspected modes of Ebola virus transmission. Upon completing the mission, the medical staff member doffs their PPE in the decontamination room, leaving only their disposable scrub suit and socks. They pass through the glass hallway and into the staff shower for an additional level of decontamination. After showering and washing their hair, the staff member proceeds into the exit lane changing room to don a fresh scrub suit before re-entering into the medical staff protective environment to continue monitoring the patient from the nurse's station. When an X-ray, dialysis, or other advanced procedure is required, the medical team follows the same entry lane procedure for changing into a disposable scrub suit, donning their PPE, checking their surroundings before moving forward, then continuing through the combination anti-room decon room and entering the equipment storage room, which also provides access to the janitor's closet. After retrieving the necessary medical device, the staff member then drives the equipment through the decon room and into the patient's isolation room to perform the procedure. After completion, they exit back into the decon room, stopping to wipe down the equipment before returning it to the equipment storage room. Once again, for laboratory procedures, the staff follows the same procedure of entering through the dedicated medical staff entry and into the protective environment. The lab staff continues into the entry lane changing room exactly as the medical staff did. They change into their disposable scrub suit and continue into the PPE room to don their equipment. After checking their surroundings, they pass through the anti-room decontamination room and enter through the glass door into the lab, where blood and PCR tests can be conducted in an optional biological safety cabinet. This unique patent-pending isolation unit was designed as a self-contained facility specifically to meet the unprecedented needs of Ebola isolation. It is designed to be scalable according to your needs and can be easily upgraded to add additional beds when necessary. The Odulair Ebola Isolation Unit is the only solution available that provides effective Ebola isolation and a safe haven for your medical team.